Now, let's continue with another three more treatment techniques of strategic family therapy: ordeal, pretend, and positioning. Ordeals are grounded in strategic family therapy, which involve helping the client to give up symptoms that are more troublesome to maintain than they are worth. In ordeal treatment, therapist assigns a family members the task of performing an ordeal in order to eliminate a symptom or to change the behavioral patterns associated with the problems. Ordeal is a constructive or neutral behavior that must be performed before engaging in the undesirable behavior. If it is done right, it can be very successful. In short, an ordeal is an intervention that seeks to extinguish a maladaptive behavior by introducing an activity that is more of an ordeal to engage in than the problem behavior itself. By enforcing an ordeal, you decrease the frequency and severity of the undesired behavior. For example, an ordeal might be to exercise before the onset of depression or to take a shower before getting angry. This can be not only more effective but more productive for the client. Another treatment technique is pretend. Pretend is a less confrontive technique that most of the other procedures used in strategic family therapy. It is to alter the presenting problem occurs through modifying the interactions between family members. The therapist asks family members to pretend to engage in a troublesome or symptomatic behavior that regarded as under the person's control, such as having a fight, or to imagine that something is disconnected so they do not have to respond to a stimulus. The act of pretending to fight helps individuals change through experiencing control of a previously involuntary action. And the last treatment technique that we are going to learn in this lecture is positioning. Positioning is involved acceptance and exaggeration of what family members are saying. For example, by saying something that has been mentioned by other family members to the extreme, such as if the family member says that their relationship in the family is difficult, the therapy might respond, "No, it is hopeless." If positioning technique been conducted properly, it helps the family to see the absurdity or a state of being ridiculous or unreasonable of what they are currently facing or doing.